First of all, my name is Clergy. I'm the Assemblyman of the 35th District here in New Jersey. I brought the Patterson people in just to clap for me. I appreciate it. But we really like to take this time as we zoomed in from Trenton in record time, thanks to my Chief of Staff. To be here at the Black Issues Convention, we thank Ms. Rita Foster and her staff for the leadership when it comes to BIC. And before I bring up the speakers, just a couple of points I just want to make about it as we go. I think it's important, and you probably heard about it today, but some of the issues when it still comes to some of the bills that we've really been pushing for, and particularly, the Breonna Taylor bill, the non-entry bill, still has not been signed into law. Many of the bills that involve diversity training have not been signed into law. A bill that I'm sponsoring, the Police Training Commission, which I think is so important. I said we've received some people in opposition to it, but if a barber, if a baker, and these other folks have to get a license, why wouldn't a police officer have to get a license? So I think we have to really stay on top of it. Even though George Floyd has been down 2 years ago, many of these social justice bills just have not passed, have not moved. And I think it's a situation where we have to move on these things sooner than later when we have a governor that supports many of these issues that are not just a New Jersey issue, but a national issue. These are national issues that we need to address. And on the budget, as the vice chair of the budget committee, when you have a $50.6 million budget, many of the issues of people in our community, people of color, need to be addressed. And one is public education. And I will say that between both houses and the governor, we have the highest amount of money in for school funding than we ever have. Ever. And if you're like me, one thing that bothers me is when I watch TV and I see a commercial, and they talk about the greatest public schools in America here in New Jersey. Well, there's the haves and the have-nots when it comes to public schools in New Jersey. There are schools still that when it's cold outside, they're going to be cold, there's going to be rain outside, and when it's hot outside, our kids are going to be suffering from asthma and not discomfort. They do not have air conditioning, they do not have labs. So we need to make sure that the zip code equality is a major issue with our folks here in New Jersey. And anytime we have a budget amount of that time, because this is probably in my life, this is my 11th year serving, we've never had a budget like this, that many of these issues are addressed. And the beginning from early childhood to women's health care, these things have to be addressed immediately. And I don't think they're up for argument. I mean, on a national level, we understand what's going on with Roe versus Wade. These are issues that we have to address. And we have to put money in it and not just our mouths. Because it's easy as a soundbite to talk about women's health care, about the issues when it comes to childbirth and unfortunate deaths, and now when it comes to women that come to childbirth. But we need to put money in our community to make sure that these folks get the proper health care that is needed. And I tell you this, the last thing I will talk before I bring up our panelists is transportation. This governor, this administration has put money into transportation. And it is so important because we know as a community, if you're like me, I grew up a latchkey kid who caught a bus called a P54, the P61. I had public transportation. My mother didn't have a car, so I knew how to get around. And if you live in any type of Jersey City, New York, you know how to get on those trains, you know how to get around. And unfortunately, we've taught our kids to only depend on us for rides, am I right? But many other folks, my kids, I think, would get lost. They ended up in Pennsylvania if they got on the bus when they were younger. But at this point now, we have to put an investment in transportation. And obviously, there's some major projects going down the road that will help our folks when it comes to employment, when it comes to education, and when it comes to fair housing. That transportation is important. So I thank Governor Murphy for making this a priority in this budget, along with our Speaker and the Senate President. And as I said, as I bring the folks up, I'm going to get over my soapbox real quick. It is, with great sadness, unfortunately, we had the Lieutenant Governor scheduled for today. And unfortunately, she is not feeling well. But we have somebody who is more than ample from her staff that can come forward, Ms. Kimberly Holmes. as I walked in, I saw her smiling face, and I said, we're in good hands. I know she can handle this, and we're going to be good to go, and we're fine. We know that there are so many other issues when it comes to the churches and safety, and so many of our police, maybe local police, state police, have gone around the churches. So we do have Colonel Major Brian Polite with us, and he's not here right now. And coming up from the turnpike, on one side, if you're a real turnpiker, you know, do not get on the car side on this side. So the car side is pretty backed up, so hopefully he'll put the sirens on, and he'll be here with us before it's over, and get things going. But our final presentation partner will be from Partnership of Maternal and Child Health. First Lady Tammy Murphy has made this a major priority. I know she's been in Patterson, she's been in North Jersey City, and it is so important that we address these issues. And we're going to have with us Maria Kinsella. Yes. Come on up, Maria. Come. So as Maria makes her way up, we have time for a panel to have a seat. Awesome. Yes. And you can grab the mic, and we have time. Maria's getting her makeup together. Maria, you look good.
Thank you so much.
And if you could, Ms. Holmes, can you just give a brief introduction?
Okay. Now my Bible will open.
Yes.
Good afternoon, everyone. My name is Kimberly Holmes, and thank you so much, Assemblyman Wimberly, for allowing me to be here. As he stated, our Lieutenant Governor could not be here, and she's such a dynamic, powerful person who lifts as she climbs. So whenever the LG cannot make it, and she asked me to fill in, I'm more than happy to do so, because I wouldn't be here without her. So I'm from Jersey City. I went to Montclair State, and it's interesting that this is with Clergy as well, because in addition to having served as an attorney for 28 years, I also went back to school, answered the call to ministry, and I have my doctorate in ministry. So a lot of people just call me back. So very happy to be here and to provide remarks that I think will be valuable, useful information for us, for those experiencing homelessness or some type of landlord-tenant issue. So I just want to bring it to the fore so we can take the information that we have here and take it back to the communities, whereas people that look like us. Thank you, sir.
Thank you. And we'd like to acknowledge all of the clergy that are here with us today. I see the outstanding and electrifying leader of our administration when it comes to the faith-based community. They're great. Thanks for being with us today. And I would be remiss if I didn't acknowledge one of my favorite people, Reverend Tuff. We miss you, Reverend Tuff. Yes, thank you, Reverend Tuff. All right. On the side now, you see our sister Delta Sigma Theta? Yes, sister. Yes. Another Delta in the house, another faith-based leader in the house. We appreciate you. So at this time, we do have, we will open up the floor for any questions that you would have had for the Lieutenant Governor. As you see, our sister is ready and prepared to answer those questions.
So, do you want me to tell them about the program?
Yes.
Okay. You know, I follow the speaker. So, on behalf of the Lieutenant Governor, who couldn't be here, I just want to thank you again, Assemblyman Wimberly, for the opportunity to participate in this Clergy Roundtable. And to all the clergy in the room, I have so much respect and admiration for clergy, as I am also a reverend as well. So I'm honored to be here with you as well, my friend. I just met you coming in. So let me just get right to it out of respect for your time. DCA has done significant work to help people stay in their homes throughout the pandemic. I can't tell you, the Lieutenant Governor, she wanted DCA to remain open during the pandemic. So we came to work every single day. every day. Even when other state departments were closed, DCA remained open, and we worked full-time, and people were calling DCA from other departments that had issues in other departments, and when people were calling, they're at their last end, they're facing eviction. So a lot of these programs were birthed out of what was going on in our country and in the state of New Jersey. So DCA is the department that's responsible for administering pandemic-related emergency rental assistance funding from the federal government on behalf of the state, as well as other rental assistance programs. So the department's efficient administration of the federal emergency rental assistance programs, we call it CVRAP. So whenever you hear the word CVRAP, those are the emergency rental assistance programs, and that began in July of 2020. And it provided up to 12 months of rental assistance to households, and it made the top national performer in the United States Treasury report. So we really did well. And because of our good performance, DCA was awarded more money. We were awarded $128.9 million in additional rental assistance funds allocated from other states. So if you don't spend the money in another state, they reallocate that money to other states that have been spending the money. So in New Jersey, through DCA under the Lieutenant Governor, we were spending the money, so they gave us more. And DCA has, yes, they gave us more. They gave us $128.9 million. And DCA has provided approximately $683 million in emergency rental assistance to more than 68,000 families in New Jersey. And I just wanted to provide a context for that. The Emergency Rental Assistance Program operates one of the largest Section 8 housing choice voucher programs in the country with 24,000 people, and we receive $275 million annually. 24,000 people, $275 million annually. We continue to administrate those programs with empathy and efficiency, and sometimes we don't get it right. Sometimes people call because they're saying, hey, nobody returned the call. And when they call us, they don't want to speak to anybody in housing if they kept calling. They'll say, I want to speak to the Lieutenant Governor. I want to speak to the Chief of Staff. And when they say that, I get right on that phone, and sometimes we have to handle those calls, and we have to make the necessary adjustments, because imagine if it was you, and if we say we're going to do efficiency and empathy, when people call, they want an answer. And they do call looking for answers. DCA administers $500 million in eviction prevention programs. That's called EPP, Eviction Prevention Programs. So it's hard to navigate with it because people don't know the acronyms. There's so many different acronyms. All they know is, I'm about to be evicted. What can you do to help me? I'm about to become homeless. How can you help me? I don't want to lose my house. What can DCA do? So through the EPP program, Eviction Prevention Program, DCA will provide rental assistance on a monthly basis for up to 2 years to approximately 28,500 households. Many of them already receive the CVRAP. So it's not like if you get assistance in one avenue, you can't get assistance in another avenue. You can still apply for more. The state has critical eviction prevention tools in place for renters who experience economic hardship, because if their income is 120% below the area median income, they can be eligible for additional assistance. And depending on the household's income level and specific circumstances, they can be eligible for additional assistance, and people have to go to the website. So it's up to us, it's up to you to let the tenants know, to let the people know, and that website is covid19.nj.gov renter, covid19.nj.gov renter, and you'll find out all about those type of programs. We also have the expanded access to counsel and homelessness diversion anti-eviction pilot programs. Because a lot of times when people go to court, they need a lawyer. They need someone to advocate for them. For some, it's their first time going to court. They don't know what's going on. They don't know anything about settlement negotiations. So DCA has these expanded access to counsel programs. And that pilot program operates in Atlantic City, East Orange, and in Trenton. So we're starting with those 3 cities first. There's a public outreach for partnerships with 6 community-based nonprofit organizations to better inform people, let them know what resources are available. And a lot of times people who are going to court are people with low income, sometimes they can't speak English well, they're disabled, they're youth, they're persons at risk of homelessness. And a lot of times when English is not your first language, you already have that barrier when you're going to court, and then you don't understand all the things that are going on. So that's why we have this expanded access to counsel. Then the Eviction Diversion Initiative has dispatched a total of 28 resource navigators. Now, when I first heard the word resource navigator, I was like, what is that? That's somebody who has experience in helping you navigate through the process so you won't be put out. So we have those people there to help people with understanding the court process, help them with applying for rental assistance, help them with applying for utility assistance. It amazes me that people don't know to apply for utility assistance. So what good is it from a practical standpoint not to be evicted, but then your lights are off, and then the water is off? So as utility assistance, that's also available, people just don't know it. So to date, the Eviction Diversion Initiative has assisted 3,000 to 3,200 people. Then there's the Emergency Solutions Grant Program, utilizing $38.7 million of the Federal CARES Act money. So you see, every time I present an acronym, I present the money that's attached to the acronym, and the average person doesn't even know about it. But now you know, and you know where to tell people to go look. I mean, it amazes me how we're not packed in here, and there's so many people facing homelessness, but we're here. So we have a duty to let people know there's money out there to keep you in your homes, there's money out there for you to get utility assistance, and there's also the federal government, HUD. I want to talk about what HUD's done. HUD increased our Section 8 vouchers. We just had Alika Samuels. She was appointed by our president to be over the northern New Jersey area for HUD. So she came to our housing conference and she talked about how they increased our Section 8. I just want to highlight that. They gave us $264 million, and we were recently awarded 163 new House Choice vouchers from HUD, and that totals $2.1 billion. That just happened. Of the 646 housing vouchers awarded to New Jersey residents, it totaled $8.3 million, and DCA received the highest allotment of vouchers. So we have those vouchers, it's ready to come out, and she just announced it at the housing conference on September 30th. Alika came up and she announced it, so it's there for us. So I wanted to bring those things out. There's so much more I can talk about. I don't want to take up the time. I'll respond if there's questions. I'll tell you more, okay? Thank you so much.
The one thing before we take any questions, can you provide your website? So many of this information I'm sure is out. And if you have your phone, if you can get your phone out and get the website and blast it out in group text to your congregants, to your fellow pastors that have this.
https, then it has covid19.nj.gov/renter. covid19-.nj.gov/renter. And if they can't get it that way, just call us at DCA at 609-292-6420. They changed all the numbers, but that number stayed the same. 609-292-6420. And a lot of times when people call, they need to have a specific person. Say, Kim Holmes, Chief of Staff. As soon as you say Kim Holmes, Chief of Staff, you gotta know how to navigate through all this stuff. And they'll turn it right into me. And then sometimes it requires me to send a direct email to the Director of Housing, that's Assistant Commissioner Winter. So we send a direct email saying, I got this issue with this person.
And like I said, please take advantage of this information. Ms. Holmes, that was an outstanding presentation. Like I said, we don't want to wish who's not here, but those who are here, we can spread the word. That's the key to it. All right. Any questions from Ms. Holmes? Yes, ma'am.
Hello. I love what you just said. I actually texted the website just to both. I didn't get a chance to hear Ms. Winter's information because they were asking me. But is it possible for your office to go down to the Riviera Hotel in Newark, ASAFP, because those people are being illegally evicted and bullied?
Let me just because I don't want to make a promise that I can't keep.
Yeah.
So let me just Tell me the name of the hotel. You said Riviera?
Riviera Hotel in Newark, New Jersey. I guess it's at the corner of High Street, and I'm not sure if that's Clinton at that point, or Elizabeth Avenue. It's Clinton, thank you. That we need somebody, it's an emergency, to give those people emergency housing vouchers because they are being removed and evicted due to the LLC boys wanting to take that hotel to redevelop it. And this is why we're having a big problem here in New Jersey. Redevelopment, gentrification, and those people need help right now.
Okay, I will let Assistant Commissioner Winter know, but I will also copy the Assistant Director, and that's Elena Gaines, and the third in command, that's Charles Evans. So I'm just calling out the names because they'll get the email to me, they'll get the email from me before we leave here.
I'm sorry, can you say the first person again?
Assistant Commissioner Janelle Winter.
Janelle Winter.
Yes, and the Deputy Director is Elena Gaines, and the third in charge is Charles Evans.
Thank you.
So I'll send the email to them before I leave today.
Thank you so much.
You're welcome, ma'am.
Thank you. Any more questions? Yes, ma'am.
The question I had is about, what we found in the community was that there was a high influx of residents who are actually on the housing list who have vouchers. And during the pandemic, a lot of them wasn't able or missed or whatever happened with communication, with appointments or recertifications for the program. And a lot of them received notifications that they would be losing their housing. So I know your agency has gotten a high influx of calls regarding that, and especially when you look at it that they're disabled and seniors. What is a community affairs stance on that, and how are we gonna rectify that problem? Because a lot of the low income, a lot of the disabled, a lot of the elderly depend on the agency's help with assistance with filling out these documents.
Right.
And with them not receiving that, how fair is it to them that they're losing their vouchers?
I do understand what you're saying because we did have a lot of people calling and they did say they missed the appointments for whatever reason. But I also talked about us having empathy and being efficient. So I don't think we can say that and not address those issues. So what I would recommend is to have whoever that is, whoever the people are, have them reach out to us. They can call me directly. You can have them call me directly because sometimes it takes reaching the right person to navigate these things through. So, and then, like I said, we did get an additional vouchers from HUD, and I know there was 500 people that they contacted that were on the wait list. Now, those people you're talking about, they're probably not on the wait list. If they missed the appointment, they probably are off the list, but there's still other avenues of relief.
These are individuals, so you know, that had vouchers, that
Yep.
had the vouchers.
But if they missed that appointment and things like that, they're probably not on that list of the 500 that was on the wait list, but that doesn't mean that DCA can't help them. So I would just, even get your name and your number so I can have some type of point of reference. So, okay.
Thank you.
You're welcome.
Do we have any more questions for Ms. Holmes? Yes, sir.
Hi.
Ma'am, yes, ma'am.
Kind of following up, I guess I might ask, common question. It's commendable that you got, all your vouchers or whatever, but what is the availability of space to utilize these vouchers?
Right.
And the second question is there, I'm just thinking of the Newark numbers, home ownership versus rental. Is there a program for, say, if somebody is renting, for them to become a homeowner?
Yes, there's a program right through DCA where you can move from renting to owning. There's definitely programs at DCA for that. And what happens is they have to apply through DCA Housing Community Resources, and it's up to the tenant to find the suitable housing. They will tell them how much it is. They work with certain mortgage companies, but those programs are available as well. I invite people to check out the website, but a lot of people don't have access to the computer, internet, gotta call. But there are programs that are available, but sometimes, most times, the onus is on the tenant to find, they'll tell you, okay, we'll give you X amount of dollars. Go find a unit that matches the money that you're gonna get. Because we don't tell people you have to live here, you have to live there. They go and find it. And sometimes we have people who live in one state and they come over to New Jersey, they call it a portability transfer. And when you do a portability transfer, what you may have received in Pennsylvania, you may not receive in New Jersey. So we've had a lot of people that came from one state to another, and it wasn't the same level of aid, and they got upset about it. But I would say we have to have some type of responsibility too, as tenants wanting to be homeowners, because it's one thing to help a person get a home, it's another thing to maintain that home. Because some people get the homes and then they walk away from them, because they may have gotten something that was outside of the means, or, sometimes people's income levels change. But we definitely have programs at DCA, and there's also programs at HMFA to help people with getting homes. So there's aid available. It's just going through the website, looking and reading, and it's also calling.
Thank you. Any more questions from Ms. Holmes? Yes, ma'am.
I was just wondering, the situation with the judiciary, how is those vacancies affecting the eviction courts and stuff?
I'll answer that. It's a major problem. It's something that we can't answer here. I know Brother Green's in here and other people who are dealing with politics. It's a long backlog that goes back to the Christie administration. So we were basically at a standstill during that time where they were putting nobody on the benches or filling benches. We're playing catch up at this point. And then you also have senators who are using senatorial courtesy to block folks to get on. So that's a whole nother issue.
How is that affecting
It's a major issue because courts are backed up. It's not just housing. It's from criminal court to housing and family court. Everything is backed up. And it's unfortunate that this issue has come about. And like I said, this is not a Murphy administration issue. This is 8 years of Chris Christie that created this backup.
That's right.
Yes, ma'am.
Another question. I know with the high influx of redevelopment going on, especially in urban cities where a lot of the developers are taking on like a high-rise mentality, and we are getting a higher influx of the rental increase. How is the Section 8 vouchers going to reflect that rental increase when tenants are expected to find units within those parameters? And what we're seeing now is that the voucher amount is lower than what the rental amounts are currently now. And is that looking to change for the residents as well? Or are you guys going to change the rules? Because I know a lot of times they can't set nothing that's more than the voucher amount, which will still give them a subsidy. But with the higher increases in rent, the vouchers are not reflecting that. So what is that? And it is hard for tenants to find apartments because of that. So a lot, and then with your agency having deadlines on the voucher with the timing that they have to find a unit by the state. I know you give them extensions and things of that manner, but what we're finding is that even that time is not enough. Like I had a young lady call your office this week. She's currently, she had a diapers case that she beat, and her and the 2 children are in a shelter. But diapers is paying for it currently, but this young lady has a Section 8 voucher. That's about to expire, I believe, this week. But in the interim, she was caught up in court battles, had 2 children, and now she's in a shelter. We have an agency in Bergen County that has apartments, but we don't even know if her voucher is going to reflect that amount for that apartment. Not to mention that we're waiting for the housing agency to make that voucher affordable. So how would you navigate something of that?
And that's a loaded question. It's very loaded, and at this time, for time's sake, we're going to actually, if you could do a sidebar for that, But many of the issues from being on housing, the shared housing, I guess, for 2 years, is a local municipal issue. When you're talking about the amount of housing that is being built, I kind of know what you're talking about, and how many are going to be affordable units. And like you said, are they going to outpace where we are? And obviously this leads to what, when you start doing that gentrification. So we understand where you're coming from, but we can sit here, and that could be a whole nother session. You talk about, when you talk about gentrification, and LLCs coming in this building and buying and pushing and moving, and you find a whole neighborhood of people that you've never seen in your whole life. So that's a whole other session. So on the sidebar, can we have that respectfully?
Yeah.
Thank you. So just to move on for time's sake, and if you could do your presentation, we would greatly appreciate minutes of that, a few words. Yeah.
So good afternoon and thank you for the invitation. I too am representing my CEO and president. She is out of the country. That's Marie Talty. She's just doing a wonderful job with our organization. I'm Marie Kinsella. I'm with the Partnership for Maternal and Child Health of Northern New Jersey. And you know, one of the things that I have worked on for the last 30 years is looking at the maternal and child health issues when it relates to our African American community. And yes, First Lady Tammy Murphy has done a wonderful job over the last few years, keeping the spotlight on the disparities between maternal and infant health in our state. New Jersey does not fare well when we look at the maternal outcomes. And I think I hope most of you know what some of those things are. We're number 48 in the nation in terms of poor maternal outcomes. That shouldn't be. When you look at where sometimes New Jersey is placed at the top. But we are doing some very innovative things in New Jersey to turn that around. My concern always has been the disparity. The disparity is shocking. You know, when we know that Black women are 7 times more likely to die due to pregnancy-related outcomes, pregnancy-related challenges than their white counterparts in this state, that shouldn't be. And I remember 5 years ago looking at the same situation, and at that time it was 5 times more likely. So what we're seeing is an increase in the number of, Black women who are really not having good birth outcomes. Our infants are 3.5 more times likely than their white counterparts to die before their first birthday. And one of the things our president and CEO always says is, people know the statistics. And while I agree with that, some don't. So it's really important for me to start the conversation throwing that out there. And I can tell you about some of the things that we're doing at the partnership, but also, the extra funding that we're receiving through the Nurture New Jersey. Just the fact that there continues to be a spotlight on what's happening. And for those of you who are interested in maternal health, I don't know how many people here have seen the there's a documentary called Aftershock. If you haven't seen it, please go to Hulu and watch it. It is very disturbing, but what it does is it gives us an opportunity to see, hey, here's a challenge, what's the solution? Because I think that's what we're all here for today, is what are some of the solutions? So I want to talk a little bit about some of the programs under the partnership. The partnership is a consortium, and we cover the northern part of the state. And the northern part of the state accounts for 50% of all births per year in New Jersey. So our mission is we're committed to improving the health of women, children, and families. All women will have access to safe births using best clinical practices. All children will maximize their potential to grow, learn, thrive through the support of a healthy family and community. And race and ethnicity will no longer be a contributing factor to health care and access and outcomes. And I think that's really important. So there's a lot of things that we have. We have the regions that we cover are Warren County, Bergen County, Essex County, Union, Hudson, and Morris. And again, you know, I'm the Director of Community Programs, and doing a lot of work in these communities has been very rewarding to see some of the things, some of the changes that are taking place. One of the things that the partnership offers is we have what we call home visitation. And this is a program where we have trained home visitors who go into the homes and support families to help them with positive parent-child interaction. And these are families who could be potentially at risk. We receive our referrals from clinical providers. These are not families that are coming in at risk, but there's a potential there. And so our workers do such a wonderful job in connecting them to the resources, such as some of the things that you're talking about, and I can't wait to get your card, because we do have some stories. And as well as, you know, and the goal of our home visitation programs, which are healthy families, parents as teachers, and our nurse family partnership, is to encourage and support self-sufficiency, self-efficacy in the family. And we see that time and time again. We have our families who, and most of the families are in the program for 3 years, and when they leave, you know, they are well on their way to reaching the goals that they've set for themselves and their children. We also have an early childhood specialist program. And this is a program where we are helping families monitor the developmental health of their children. You know, their developmental health. And I think that, you know, about 5 years ago, the state of New Jersey, through DCF, received a wonderful grant opportunity to support coming up with innovative strategies and how can we support parents and really help them measure and learn about, you know, their child's development. And this focuses on the 0 to 3 population, which is extremely important, because unless there's a solid foundation there, everything else is lost. And so that has always been my passion, the 0 to 3. And so some of the other things we do, of course, we work with moms prenatally. We really focus on that bonding that can happen while baby's in utero. We have a postpartum, or what we call it now, the perinatal mood disorder programs, where we address those things. We have the FEMA, which is the fetal infant mortality review, and this allows us to look at so many cases over the course of a year where we had a baby who did not make it in utero. And then, yes, and so we're able to look at so many factors, the social factors, any of the medical factors, and then really provide support and education to our clinical providers to hopefully, you know, offset that. We have family success centers, and I don't know if you're familiar with that concept, but it's a wonderful opportunity for families to come in as a unit, and really there's activities that go on. They provide tutoring for the children. There's also literacy, financial literacy. You know, I heard someone talking about, you know, how a person can go from renting to owning their own home. Those are some of the seminars and modules and things like that that we bring into, you know, we bring to these families. We have the immunization department. There's just so many things. We also provide education and information to our clinical providers, because there's things that they need to know. We want to keep them updated with some things. And so one of the things that I'm most proud of is, I don't know how many of you are familiar with doulas? Yes, yay, doulas. So I've been, one of the things that I was concerned about, and the state heard this, that we had no doulas, no free or affordable doula services in the northern part of the state. And through the generous work of some foundations, Berg, Tau, and I don't want to forget anybody, so maybe shouldn't use those, and Terrell, we were able to develop a program that we brought to Patterson. And we were trained, myself and another young lady, we were trained to be trainer-trainers. we trained 13 women of such diverse backgrounds to become doulas so that they could support the women in our community to make sure that they had the healthiest and most respectful birthing experience possible. And we just graduated the 13. I myself, because of my interest in this work, and I think for all of us, you know, we know where our passion is. My passion has always been maternal and child health. I see yours as housing. You know, the panel before us was about voting, and I think everything kind of comes together. But, you know, my hope is that at some point, New Jersey will be the leader in positive birth outcomes for everybody, you know, in the state. And with the programs that I mentioned that the partnership offers, as well as other organizations throughout the state, I think that we can achieve that.
Well, thank you. And can you provide your website or your contact information?
Yes, the website is www.pmch.org. We made it real simple. It used to be so very long. And it just came down to the P as in Peter, M as in Mary, C as in Charlie, H as in Harry.org.
Thank you very much.
So,
Yes,
I
ma'am.
have a quick question.
Yes.
So the Black maternal death rate spans beyond class, socioeconomic status, and all of that. So what kind of work has been done around shifting the mindset for those providers, those doctors? Because they're Black women who have access to the best health care in the world. You know about Serena Williams' story, right? But they wouldn't listen. So what work are we doing around shifting that mindset?
Well, you know, I'm glad you brought that point up, because anytime we talk about Black maternal poor outcomes or Black poor infant outcomes, it always comes to, well, it must be those women who are using drugs. It must be those women who are homeless. That's not the case, you're right. It goes from the person who just, you know, received their GED to that PhD educated person. It does not matter, and we're seeing that. And you're right, it was through Serena Williams and even Beyonce, who had some negative birth experience, that were definitely connected to who they are, the color of their skin and their race. And so again, I think one of the things that we continue to do is bring the facts to our providers. And I have to say, the providers that we've been working with are very open to say, well, what can we do? So one of the things that we did in Patterson was we were able to bring a group of, well, 3 groups we had, of birthing people, Black birthing people in Patterson together to talk to them. And some of the things that they told us about the local providers or the hospitals, we took back to the hospital and to those providers, and guess what? They started making some changes. So, I mean, it's little things like that. I think someone before said, you know, you throw the marble in the ocean and at least it starts to ripple. But I do think for us to continue to do things like this, we have wonderful staff who are so passionate about the work, you know, and the fact that we do have a current administration that is keeping this at the forefront. Because as I said, I've been in this work for many years, and I was always so disappointed that, I mean, for those of you, there might be some of you who remember we had something called Reduce Stress for Babies Best. That was a Black initiative. You know, we were trying to offset the disparities in infant mortality. And it just seemed like, you know, that it would be ebbs and flows, like, oh, it's on, you know, it's out there in the public, but now we don't hear anything. I have to say, with this administration, it has stayed up front, and so we're really grateful for that. And it's also given those of us who are in maternal and child health an opportunity to develop new strategies and interventions that we hope are going to continue to support the work that we do, so that there's not going to be any disparity between, you know, I'm not going to be any more at risk than my white counterpart. So I think we're just going to continue to just spread the word and make sure that people are aware of what's happening in their community and keeping up with the trends.
Do you have any more questions? Yes, Roundtable.
I got a call yesterday from a young lady. She is, I believe, child, but she's on disability. She is homeless, and she had nowhere to go. And I searched around, I couldn't find any help.
Okay, so can I ask you what county you live in?
Essex.
Okay, so I'm going to give you some information on what you can do, because we also have community health workers, and all the consortium have them, and their job is to connect women to prenatal care and shelter. And there are specific shelters for pregnant women. And I will give you my card afterwards. If you call me tomorrow, I can make a connection for you. Because we saw a lot of that as well. You know, pregnant women who have no place to live and are maybe, you know, sleeping under a bridge or something.
Yes. Do we have any more questions?
I just also want to add also women who may be impacted by domestic violence. There are quite a few centers in especially Essex County that support that work. Okay.
Any more questions? So as we wrap up, we of course love I'd like to thank NJ for I think this is such an important topic. As we all know, Reva Foster is absolutely the best, so she brings the real deal into the community. We ask the clergy that are here, you know, that you guys, you know, spread the word. This information on housing and maternal health care, these are foundations of our community. These are things that we need to talk about more and be involved in. The fact that, you know, the Beyonce and Serena Williams situation says it all. I'm a coach by trade, and they say they treat black athletes so much differently when it comes to concussions and sprain. So we're always perceived as being a little tougher. Like, oh, they'll be fine. They'll ask them to go. So that's important. And when it comes to housing, there are opportunities out here that we have to take advantage of. We have to school them. And I know there are many houses of worship in the state of New Jersey that do exactly that. So, you know, after the word, you know, during the week, you know, make sure we get housing information out, because the quality of housing is going to have an impact on their education, on their future, on their health care, on the quality of your neighborhood. You know, the smarter, the more educated you're probably going to have it. And I'm not talking about college educated. I'm talking about carpenters and plumbers and mechanics. Things like this are making a difference. So, NJ Big, Ms. Reed, we appreciate you so much. Thanks for having me. The fact that I got here at 35 minutes from training is amazing. I thank my chief of staff, and we don't even have a siren, anything for NJ Big. So God bless you and enjoy the rest of your time.